Well, expanded access is really a process by which we generate hypotheses. It's really not really not sufficient to prove what we think is happening. And so what we want to do is use RT001 in a larger cohort of those patients. And so we're actually starting such a more rigorous clinical trial in the next few weeks. So rather than just giving it to the kids and seeing how they do, we have a much more rigorous way of evaluating them before they get the drug and then after they get the drug to see if the observations that we've seen in 2 children translates to a more general effect on them. And then the other things that we're doing with RT001 is using it in expanded access programs in other diseases besides INAD in which it may have effect. So we're beginning programs in ALS. We've used it in GM1, which is a gangliosidosis, in Tay-Sachs, and so other conditions in which oxidation is a problem. We're going to continue to try to apply it. And then if we see the kinds of results we've seen in INAD, we may well expand the therapy in a more rigorous clinical trial, the way we're doing in INAD now. We have actually done a phase 2 clinical trial in Friedreich's ataxia in which we showed some benefits. And then the second thing is that we're beginning to apply the same technology of putting deuterium, substituting deuterium into linoleic acid. We're going to be putting it into other long-chain fatty acids like DHA and arachidonic acid, which we think we may have even greater benefit, particularly for some other conditions like retina conditions, in which mitochondrial disease and oxidation is apparent.